Okay, I'm now recording the session as well. Thank you. So at the time of putting this presentation together, this is the information we put together for you was most accurate and correct. What we've done is taken the government gazetted regulations and we've tried to break it down for you. If you watch this session in May of this year, May, it was earlier, I must tell you that it is going to be very similar because the information hasn't changed. We've tried to update it as much as possible, but I do want to then encourage those of you who have seen it before and might have questions or might have come into some issues or concerns, please pop that in the chat section for us and we can try and answer those questions for you as best as possible. I won't be doing the training today. I will be handing over to Ruth, who is our training, one of our community trainers. The last time we did this session, Ruth had some technical challenges, so I actually took over the session, but today she will be doing it. Let me actually switch on Ruth's video as well, so that you can see who's talking to you this morning. Some other housekeeping things. For those of you who are joining as a school or as an organization that has multiple people watching the session, it would be really helpful for us if we could get a list of those people who are watching it with you. If possible, could you pop an email address in the chat section for me so that I can email you an attendance register and you can have that filled out. Alternatively, if you're taking an attendance register, I'd be absolutely fine with you scanning that in and emailing it to us. By doing that, it also allows us to give all of your staff an attendance certificate, because at the moment what we'll be doing is sending attendance certificates to everyone, but it will be basically everyone who's signed in and the email address that has signed in and registered for the session. So if you'd like attendance certificates for all your staff, please send us a list of everyone that has attended. I will pop my email address into the chat section at the moment. It is programs@wcfid.co.za. So please send me either a copy or a scanned in version of your attendance register. And if you've attended multiple sessions previously and you have those registers, it would be very helpful for us. We'd really appreciate that. Thank you so much. I'm not going to take up much more time. I think that was basically the only housekeeping. For the entire session, we will keep you on mute. If there's something you'd like to say or ask, please, there is an option of raising hand or just type it into the chat section. And then if possible, please could you turn your video off as well. The way Zoom works is that it works on the basis of bandwidth. So what that means is the more of us that are using this connection, the poorer the connection becomes. So in order for us to ensure that all of our participants have the best access to this connection, can I ask you to please switch your video off? We don't particularly need to see you. And then if you want to say something, I can unmute you later on when we're doing questions. We've got some people that are, the session is being screened live to Facebook. If you've got some other people that you'd like to ask to attend or to see it. If you are watching via Facebook, again, please let us know so that we can send you your attendance certificate, and I will be giving you an evaluation form towards the end of the session as well. Because I think I've covered everything. Have I?
I think so. Great.
Fantastic. I'm going to hand over to Ruth now, everyone. Let me switch off my video as well. Again, we're going to answer questions at the end of the session. So if possible, please add your questions and then we'll get back to you at the end of the session. If you are signing in, please give us your name and surname and the organization you're from. I know there's a lot of you that we know that we've seen quite often, that we've worked with quite often, but because we've got so many people attending these webinars, it'd be really helpful if you added your name and surname so we know who we're talking about when we send certificates. Excellent. Ruth, I'm handing over to you. Enjoy, everyone.
Good morning, everybody. Welcome to, oh, hang on, let me just check that I'm not on mute. Why am I on mute? Right, there we go. I hope everyone can hear me. I can see myself talking. Great. Okay, so welcome to our session this morning. As Amy had said, it is similar to the previous session. However, there has been some adjustments. And also what's been quite helpful is that I've obviously at the same time as doing this, been developing Western Cape Forum's own COVID return to work plan, which has really given me quite a lot of extra meat to this particular presentation. Just as much as Amy said the last time I had technical difficulties, apologies for that. This time I've decided to add some more excitement by getting 2 8-week-old puppies, which unfortunately I can't mute, but I have put them outside and given my daughter excellent information on how to manage them for an hour. So hopefully we won't have any visitors during this time. Okay, let's get started. As all of you know, we're now in level 3 lockdown. And to be honest, once I'd received the information, not much had changed other than more release of economic activities and a lowering of permit requirements. Permit requirements only needed for traveling to other provinces and around students and that kind of thing. So let's start by going through the first part of our presentation. I'm just trying to see why it will not. There we go. Okay, so topics for discussion: overview of COVID-19 regulations. What does a workplace plan mean for employers? How do you unpack what occupational health and safety measures they're talking about? Practical tips on social distancing, safe work practices, and take-home points. As Amy said, if there are any questions that you have, please pop it in the chat section. Any information that you're requiring, any questions that you have, we're going to try our very best to answer on this platform, or alternatively via mail after this particular session. So again, it's so important that you need to understand the regulations that talk to the lockdown requirements when you go back to work. And you need to look at the Disaster Management Act, 2002, regulations issued in terms of 27.2 of the Disaster Management Act, occupational health and safety measures in workplaces, and Department of Employment and Labour Workplace Preparedness COVID-19 risk assessment templates. So every time a new level comes out, there's an addition that's put through by the Department of Cooperative Governance. I think that's them. Mrs. Zuma, she comes along and says, okay, these are the new regulations, and they'll pertain to the particular lockdown that you're talking about. So you need to look at level 3 regulations. However, looking at them, there's not a major shift from the initial one that was released in April. On the 28th of April is the occupational health and safety. And the disaster risk one came out on the 29th of April, and I'm sitting with both of them in front of me here. Okay, so it's very important that you understand what is contained and required in those particular levels. So according to regulations set out in the Disaster Management Act, all industries, okay, I've seen I've still got level 4 return, it's level 4 now / level 3, all industries, businesses and entities, both private and in the public sector, which are permitted to operate during level 3 must designate a COVID-19 compliance officer who will also oversee the implementation of the plan, adherence to standards of hygiene and health protocols relating to COVID-19 at the workplace, develop a plan for the phased-in return to work of their employees prior to reopening the workplace for business. This plan must correspond with Annexure E that's found in the Disaster Risk Management Act and be retained for inspection and contain the following information: which employees are permitted to work, what the plans are for this phased-in return of their employees to the workplace, date of reopening, timetable setting and opening times, if your times, for example, have shifted compared to what they were previously pre-lockdown. What health protocols are in place to protect the employees from COVID-19, and the details of the COVID-19 compliance officer. Furthermore, the workplace policy needs to look at a phase in the return of the employees to work to manage the return of employees from other provinces and other district areas. Obviously, interprovincial travel is now allowed, and obviously you need to make sure that anyone that's coming back from the different provinces, that there's a phase in return of these particular individuals. You need to develop measures to ensure that the workplace meets the standards of health protocols, adequate space for employees, and social distancing measures for the public and service providers as required. Previously, they stated that you needed a permit. At this stage, it doesn't appear that you're needing a permit for the level 3, but if you are traveling across provinces, for particular reasons, you're going to need some more information regarding the travel between provinces. Administrative control. So how do you prepare your workplace in terms of occupational health and safety measures? Okay, so we talk about administrative controls. So typically administrative controls are changes in work policy or procedures to reduce or minimize exposure to COVID-19. So basically the idea is to minimize the possibility of transmission at your offices, in your protective workshops, in your schools, wherever you, between your staff, how do you minimize that possible transmission? And it's so important to understand what the virus is, how it is transmitted, how it operates, what is almost the incubation period, who are the most vulnerable. You need to educate yourself around the virus, but also be careful on the information that you read about. So go to particular websites that give you verified information. So WHO or Center for Disease Control in South Africa, any government websites. Often at the moment, there are lots of Facebook posts and there's this information and don't do this and don't do that. And this is what happens between children. And this is what doesn't. And it's a lot of fear mongering that does happen. Obviously, it's a virus. We're all trying to understand it. It's obviously quite new and there are lots of elements that are unknown, but there are known aspects of it. So educate yourself well so that when your staff comes back, you are the master, so-called, of the correct information, so that when you are dealing with your staff, that you're able to alleviate possible stress concerns that they might have, and also stigma, which we'll talk about later, that can come up in communities and wherever around the particular virus, and how that can impact on work productivity as well. So every employer must complete a risk assessment to give effect to the minimum measures required for that workplace. Okay, so basically you need to understand what kind of organization am I operating here? What are the risk factors in terms of how much connectivity do we have between ourselves and the public? What is the space around between our communication between each other in the office? Do we have a lot of meetings where it's one-on-one? Is there a way we can shift that to digital or over a phone call between offices? So you need to understand how much risk your particular organization has in terms of the possibility of transmission of the virus. So you need to identify the risk exposure, and you need to have a look at what would you consider high contact activities. So we think about, think of a secretary or administrator who receives people to come in to sign a register, who receives stuff be dropped off at the organization. Say the printers in the receptionist's office. So you have a lot of feet moving in and out using the printer. So that could be possibly a high contact activity coming in and out of an office. Also considered a high contact area. Your kitchen is a high contact area. The bathroom is a high contact area. But for example, your finance person who sees maybe one or two out of the whole group of staff would not be considered a high contact activity. So you really need to examine the different aspects of your organization. Another thing that was spoken about quite a lot is identifying vulnerable workers and look at special measures for their protection. What measures can and would you be able to put in place? And we're going to talk about that a bit later. Develop risk control measures for your staff. Different workers are going to have, again, as I mentioned, different risk exposures. So whilst I might be working on programs and I'm in my office, I'm not going to see a lot of people. Our administrator might have a lot of people having to come in and drop stuff off. So you need to understand the different risk exposures. Just as much as a cleaner who's probably cleaning throughout the office in the bathrooms that lots of people have used, they would be considered to be at a higher risk exposure, for example, to me. You have to look at what risk control measures are you needing to put in place as per the risk assessment that you would have done of the worker. In order for them to do their work function, what do they need? So you have to look at, well, what protective measures, what PPE can you put in place for? Does a person need an apron? Do they need like a face visor? Do they need a desk shield? Do they need eye protection? And very importantly, as we said at the beginning, you need to appoint this COVID-19 officer, okay? Because this is the person that is going to ensure that all the COVID-19 prevention measures are complied with. They need to be there to address employee or workplace concerns. They're the person that's going to make sure that the health and hygiene protocols are complied with, that the work plan is complied with. And again, you need to ensure that your compliance officer must be displayed. Their name must be displayed in the area visible, and this needs to be communicated to all your employees. And looking at the skill set of the COVID-19 representative, this is new. This is new to everybody. So I was looking at some Googling and trying to find out like, what are the key aspects needed for a compliance officer. Now that I'm being appointed compliance officer for the forum, I'm needing to look at my own skill set. What do I need to update myself in order to make sure that I can render this particular service correctly and that all the information that I'm releasing is correct, that everything that needs to be put out there to ensure that the reduced transmission and protection of workers are in place and our clients. So I would strongly suggest that your COVID-19 representative has to understand and have the ability to understand the knowledge of the existing legislation and policies relating to COVID-19, be able to translate that into training of other staff, be able to translate what is required in terms of the signage, in terms of the health protocols, all of those aspects. That person needs to be able to deliver that particular service. So it's fine to have it on paper, but when it actually happens, you need to know that that person can test it out. So, for example, my husband works for provincial government, and he's a COVID-19 officer, and they had a case of COVID-19 in their office. And it was quite interesting to see how his plan that he had developed had to now actually unpack and work. And because he had everything down the line of, okay, when someone's identified, I need to do this, I need to do the tracing, I need to make sure that the person is assessed, and so on. So if you've got that in place, you are going to be fine if anything should arise. But you need to make sure that this person is able to hold that space and is able to be supported in that space as well. Because it can be quite daunting, and you need to check that that person's ready and available and feels comfortable to take that particular task on. So when we're looking at a risk assessment, so I posted this the last time as well, which talks about how do we know if our employee has a high risk job type or a low risk job type. So this particular grading template helps you unpack. For example, low would be someone that doesn't require a lot of contact with people. So for example, I'm going to keep using our finance person, but it's a chance that Michelle's not going to really interact with a lot of people. So her risk would be quite minimal or low. Okay. Someone that has more of a frequent contact, and you'll see within 2 meters of people who may be infected, those are people that might have a lot of contact with travelers who've returned, or if you're looking at an office, your receptionist, for example, admin person, might be more on the level of 2. Possibly 3, depends how many feet you have coming in your door to do administration. And what we're saying is, while you're doing your assessment, you literally are going to go through all your staff complements and unpack their job function. And you're going to pair it against this risk assessment to understand, well, if this person is doing this job, what is their exposure rate? And what do I need to put in place? So, for example, if you go to the second template that I've got on here, it's quite nice because you can adjust it slightly. You can identify what the risks are, you can identify their job type, you can identify their exposure risk, and from that point you can also look at what can we do to mitigate the risk. So for example, a receptionist, okay, so what can we do? Can we shift her desk so that the rest of the staff is not coming in the whole time to do printing, and we separate her from that contact? If she has a lot of deliveries coming in, do we then put up a desk visor and she wears a shield or a mask? And you also put the meterage spacing between people who are approaching the desk. So I'm sure a lot of you have been to the shops. And say, for example, you've gone to the pharmacist and they've got the Perspex screens up. They've also got the tape that says you're only allowed within a certain range. You can't put your hands under the screens. You can't do this, can't do that. And all of that is really helpful to reduce transmission rate. But it's important that these kind of protocols that you're putting in place are explained to your staff, as well as putting a signage up for visitors that are coming in. This is how this organization is operating in terms of reducing and minimizing transmission and contact. Please adhere to the following. You can have the sign up saying you do not enter without a mask. You can put up, I'll talk to you, a testing station that we're setting up in our office, just to look at ways in which that you can assess who's coming in. You can mitigate the transmission rate. You can put up protective shields and set up to protect your staff and employees and ensure that social distancing is happening. So this risk assessment template is quite helpful. This is something that we've sort of started to put in place to look at what is the risk factor of each individual in terms of comorbidities and age. So this is just a basic example. And we're also very, very conscious around confidentiality. you can't necessarily have a list saying, please tick the following. Do you have an autoimmune disease? Do you have a heart condition? Do you have diabetes? Do you have HIV/AIDS? Do you have this or that? It's really, you're going to really put yourself in a corner. I would strongly suggest that we list the potential comorbidities that have been identified as high risk factors. You put them on the one side, and on the other side, all you have to say is you do not have to identify which comorbidity you have, but please indicate if you have one or not. So you're not going to ask the person to please say, tick, I've got diabetes, I've got this, I've got that. You are saying, well, if anyone comes up with any of those, that's a warning, that's a flag for us. If the person's happy to disclose, then you can work with that. If they're not, you're just going to have to take that whatever comorbidity is identified on there is one that is needed to be taken into account. And what I'd also suggest is that you can request a letter from their doctor which supports the assertion that there is a comorbidity. They don't have to detail what the comorbidity is, but you can ask proof, for example, that this comorbidity exists if you want to go to that level. And also very importantly is, are you over the age of 60? And it's important because that guides you in terms of what your risk is in terms of your employees. It guides the planner of the COVID plan collectively to unpack, for example, what needs to be put in place to protect the staff, to protect that particular person, and all of those that are coming in contact within your organization. So as far as possible in your return to work, look at trying to minimize the number of workers at the workplace at any given time. You can do rotation of workers, you can do staggered working hours, you can do shift systems, you can do remote working conditions where possible in order to achieve social distancing. You can restrict the face-to-face meets using virtual technology, and you need to consider the staff with comorbidities and those over the age of 60. And I think we could be quite proud of ourselves in terms of looking how resilient we are as individuals in adapting to a new normal, to ensuring that our work continues in whatever form we can, keeping in line with understanding what is required to reduce and minimize the risk of exposure. So I certainly feel very technologically advanced than I was pre-lockdown, hence now I'm doing webinars. So make use of your WhatsApp video calls if you want to have meetings, Zoom, there's also Microsoft Teams. There are lots of technologies that you can put in place to reduce the amount of contact that you have. Employers also need to provide information. So the COVID-19 officer within the policy really needs to make sure that the staff and everyone is fully understanding what you're trying to say about the return to work plan, and also unpacking COVID-19, unpacking what does everyone understand by what the symptoms are of COVID-19, because at the moment we're hearing a lot of people that we know. I know in my particular case, I've had family members that have recovered from COVID-19. I have had friends whose colleagues have passed away from COVID-19. So it's really, and family, it's really relevant, and it's touching a lot of lives in different ways. And from that, you need to address that with your staff, because when the return to work happens, you need to understand the psychological space that people are returning in. We can put all of the PPE in place and all of that, but we need to make sure that our people are comfortable, that they feel confident, that they feel that their employers understand what the virus is, they understand the transmission rate, and they're putting in place what needs to be put in place. On the opposite side, the responsibility of the staff to adhere to the protocols, to wear the mask, to sanitize, to social distance, to make sure, for example, I'll talk a little bit about that. I've gone to quite length around what to do in the office. So if you are in your own office space, but you need to go to your colleague's office space and you're using her stuff or his stuff, you need to make sure that whatever you have touched, you have sanitized when you exit. You leave the office in the same space as when you return. However, when that colleague comes back to the office, the first thing that person's going to do is going to wipe down the surface areas. So you have the responsibility of the individual, and you have the responsibility of those that might have accessed that space. So information leaflets would include personal hygiene, social distancing, how to use your PPE correctly. Looking at the stigma associated with COVID-19, unfortunately, that is going to happen with anything that happens with a pandemic, with a disease, where there's a lot of fear, where there's a lot of misunderstanding, where there's a lot of information that's floating around on social media that may not be verified. And that is also increasing the fear and anxiety. So it's important to talk about stigma around COVID-19. And also to talk around safety when using public transport. We cannot guarantee that every public transport is adhering to protocol. As an individual who's using public transport, you cannot get onto that public transport if you feel that the social distancing is not correct, that the person is not masked, that the person's not providing adequate sanitation. Where that's not possible in different environments that we live, ensure that your employees have their own mask. They need to have their own mask, and that they have sanitizer. So even when they're going in there, they feel that they can utilize the transport because they have their own protective measures in place. For example, say that other particular transport doesn't. So what we thought would be all really, really good, and we're going to also, I'm not sure if Amy mentioned at the beginning, is that we are creating a package of information, which is going to include all our assessment forms, screening tools. I'm going to upload some of the infographics that you can use, upload some of the stigma aspects and how to deal with it. And those are going to be freely available to the forum members who would like to access this. So we're putting it together, and we'd like to have it ready by the 1st of July. And you'd be able to access it online by just completing a simple sort of registration, so that we actually have the names of individuals who are downloading the particular documentation. If you can't have access or can't download, then we're going to put it on a disk, which is going to be available at the forum from next week, and we'll send out the times that it's available. So as you can see, what we've tried to do is put infographics that are user-friendly, that are understandable, that you can print and stick up within your environment, talking about hand washing. And then also the do's and don'ts around how to talk about COVID-19. So, you know, like, you're not going to refer to people as victims or as suspects, he's a suspected case, because people talk about the words that we use. And I think it's also important how we think about how we talk about disability, the do's and don'ts of disability communication. Or he's wheelchair bound, or that person's deaf and dumb. And the language that we use impacts on the individual and how they feel about themselves, and also how we engage with that person. So that's why talking positively, emphasizing the effectiveness of prevention and treatment measures, will help people take on the responsibility of looking after themselves in these particular times. And it's also caring about people that might have got COVID-19 and what about acquired or contracting it, and how people can communicate with them so they feel supported and not rejected. These are the basic social distancing practice tips, and I'm sure by now we're all probably sick to death with the amount of social distancing. Although I must admit, I was joking with my colleagues and with my family around how hectic I am about social distancing. So I'm standing in the pick and pay line, and we're outside, and we've been doing this for how many months? Like 2-3 months now, and they are just sort of circles. You need to stand in this circle and that circle. And the person behind me kept sneaking up. And I kept moving away. I don't know if any of you have done it. You're trying to get some space because you don't want to sort of like make them feel embarrassed. And to the point that I was like, listen, guys, seriously, just need to help you out here. Here is the line you need to stand in. And this is where I'm going to stand. And could we all just social distance for everybody's sake? So I think, you know, we also need to be aware of where we're at emotionally, but also to understand that it's important to keep these social distancing aspects alive, and they're practical tips, and they're important to reduce transmission. So we really need to make sure people understand why we are doing this, how the droplets spread, and why this distance is so important. If it is challenging to ensure that social distancing happens, you can arrange physical barriers between workstations, supply the employee with full PPE based on their risk assessment. Reducing the number of staff on duty can assist with achieving social distancing. and if possible, minimize contact by using, as I mentioned, virtual communications. Social distancing measures to be implemented through supervision, both in the workplace and common areas, include like queue control, divide staff into breaks, staggered phase and return to work, minimize contact between staff and members of the public. Not everyone have a whole chinwag congregation in the kitchen. As much as we'd all like to move back to the space of just getting together and talking, we need to still be aware of the fact that we're moving into quite a peak of this particular virus. We need to ensure that we minimize our contact continuously throughout until the different levels are reduced. So let's look at how you can stagger the breaks, how you can reduce get-togethers in different parts of the office, and just explain why. Okay, so this is quite important that we wanted to talk through was how do we employ health and safety measures? And what we'd like to say is that we've put together quite a nice comprehensive screening tool. And I've taken it from the Occupational Health and Self-Safety. I've taken it from City of Cape Town around their screening protocols, and also our disaster risk management aspect. So it's quite comprehensive. So you need to look, and again, our disclaimer is that this is our information based on what we've gathered at this particular time. You need to develop it and make it in condition with your particular organization and what works for you. And by all means, you need to read these documents and regulations to be completely understood what they're trying to say and why they're trying to say it. So what we've decided to employ is a testing station in our office. So for example, I come to the office and I walk into our training room, and at the training room, there'll be a thermometer and there'll be a form that I need to fill out. And the form will say, for example, my name, am I experiencing currently any of these particular sort of symptoms, fever, cough, sore throat, body pains, headache, shortness of breath, and then additional symptoms would be loss of taste, smell, nausea, vomiting, fatigue, okay? And then I'm gonna take, for example, if I'm only one of the office, I'm gonna take my own temperature and I'm gonna jot it down. So anything over 38 degrees is considered a concern. And if I am presenting any of those symptoms, I need to leave the office, okay? However, within our actual COVID-19 return plan, which we're going to provide as a template, it details a lot more specifically on how to manage a staff member who may be at work and start developing symptoms. So for example, if you are at the office and you are experiencing any symptoms, you need to inform your manager, for example. So just going back quickly, so this is an example of the entry into workplace. Now I've made it a little bit more user-friendly in terms of and added some extra information. So this was National Health and Laboratory Services template that I also used, and then we developed our own. So you would be able to use our one and then add to what you want to add and utilize. So basically, for example, if a staff member presents with COVID-19 symptoms, do not permit the staff member to enter the workplace. If staff member is already at work, immediately do the following: isolate the worker, provide the worker with an FP1 surgical mask. If you don't have, just make sure the person has a mask. Arrange for the worker to be transported for self-isolation. The worker needs to be go to their medical practitioner, GP, for an assessment, and they will probably refer for testing. And also that you need to ensure whoever that person's interacted with in terms of staff, that you need to look at putting those particular people in self-isolation, and that they, if they start presenting with symptoms, would need to contact their general practitioner or clinic, at their local clinic, and so on, or contact the COVID-19 hotline. So what we're saying is assess the risk of transmission where this potential person was experiencing COVID-19 symptoms. That area needs to be cleaned. And again, refer any who may be at risk for into self-isolation to reduce possible transmission. So that's the process in terms, it's a lot, we have a further detail in our actual plan, which will be available to all of you, which details very specifically more what you need to do. If that member presents with the COVID-19, you make sure that staff member is tested or referred to a testing site. When that person wants to return to work, they have to have tested negative. And also they need to have not presented with any symptoms. And when the person does come back, the COVID-19 officer needs to monitor any symptoms that might start coming up again at the workplace. And that person needs to adhere to strict personal hygiene. We are also obliged to report to the Department of Health and Department of Employment and Labour if any employee is diagnosed with COVID-19. And the employer must also investigate the cause of infection, for example, if there has been any control failure in the workplace. Now, it is an unbelievably contagious virus that is easily spread. So we need to just be mindful of the environments that we're creating so that we can minimize the risk of transmission, so that we can put in place any extra transmission sort of control that might also reduce the impact of the spread. And employer needs to assist with contact tracing information. So what is quite, for example, with the COVID-19 plan that we've developed is that you would then make a list of anyone that you would have been in contact with within the office and within your home area. And that information is so helpful for Department of Health and other contact tracers. I have a few colleagues that are contact tracers for COVID-19, and it's so helpful when there's a comprehensive list of people that can be contacted so that you can isolate individuals so that they can self-quarantine and self-isolate. So again, looking at safe work practices, sanitizers need to be at least 70% alcohol. It's important that this is provided by the employer. So for example, at the forum, we're going to have sanitizers in the kitchen or in all staff areas, in the meeting rooms, and obviously at the testing station. Just to mention, when we talk about our testing station, I'm very aware of the fact that when you're going to come in there, you need to sanitize even the door handle that you've opened as you go into your testing station. You need to sanitize the thermometer that you've utilized. You need to sign your the form that you've got with your own pen. And if you are going to share another person's pen, which is not advisable, there should be a pen provided. You need to clean that pen afterwards. And as ridiculous as it might seem to a lot of people, you have got to be as on top of this process as possible. Every mitigation needs to be put in place to reduce the possible transmission risk. So employees need to ensure that there are enough sanitizers based on the number of staff who access the workplace at the entrance in the workplace, which workers or other persons are required to use. If staff interacts with the public, we've also developed a screening tool to look at visitors that are arriving. Also, the visitors need to be aware of what control measures that you've put in place for entry. You can deny someone entry if they're not wearing a mask. It is not your prerogative to supply visitors with masks. By now, we all know that we need to have a mask, okay, as an employer to your employees to provide masks. But for visitors coming in, they need to have their own stuff. And they need to sanitize before coming in. Once, for example, the visitor has left, you need to clean the area that the visitor was there by cleaning the surface that the visitor was at, as well as any equipment or any thing that they may have touched or used. So what are safe work practices? Basically, we need to look at the pre-clean prior to the return of the office. So some of us may not have been back to our offices for weeks, months now, but you need to go in and do a complete pre-clean prior to return to work. You need to set up a cleaning regime for your offices. You need to identify what would you consider high-risk areas for areas that need more cleaning during the day due to high contact. So that would be the bathroom and the kitchen. All surface areas and equipment must be disinfected before work begins, regularly during the work day and after work ends. Now we also need to be a little bit more sort of logical, depends on how many people are working in your office, how many contact spaces there are. And you need to then adjust your protocol based on your actual organization and your center. Now, as we know, the protocol has not come out yet for special care centers. And we need to be mindful of what is being presented today is in the current legislation. There will be additions, I'm very sure. And we will then, once we have knowledge of this, be able to provide extra information regarding that. So all areas such as toilets, common areas, door handles, and electronic equipment are cleaned and disinfected. So what we've done, for example, is that towels are a no-go. You need to have a paper towel system. So when you dry your hands, you're going to throw the paper towel away. When you're cleaning an area, you're using paper towel. Okay, so we've had to then, and we understand there's a cost implication, and there has to be different ways in which you can reduce the cost by doing different, still adhering to the protocols, but just being smart about what sort of PPE and equipment you're going to bring in to ensure sanitization is happening. So, for example, we've now got roller towel dispensers in our office. We've got sanitizers throughout our office. And we've got protocols within our COVID policy return plan on what a high contact area is. What do you need to do in the bathroom? And how are you going to use a printer? For example, the printer is quite a widely used aspect of our office. But we can't keep wiping, potentially damaging the equipment by applying sort of disinfectant the whole time. So what do we do? So do we say then in our protocol, if you're going to use the printer, you sanitize your hands before using it, you sanitize your hands after using it. Okay, so there your risk is limited. Another aspect is I've been advised that our particular printer has a stylus and a stylus holder. So in order to access it, you must use the stylus and the little holder. So afterwards, I sanitize my hands before, I then sanitize the stylus and the holder, and then I sanitize my hand after. That way, you're not putting all the sanitizing solution all over your printer for electronic equipment. So these are aspects you have to interrogate and understand. Okay, so I'm just going to move on quickly. So ensure adequate facilities for washing of hands with soap and water, ensure paper towels are there, no fabric toweling, have staff trained on how to wash and sanitize hands regularly, ensure that interacting with the public must sanitize hands between each interaction, and surfaces that need to be cleaned after interaction with employees. Use of masks, you need to train your staff members on how to use masks properly. I mean, we have lots of people walking around with their schnoz, their nose is exposed, or they're on backwards, or they're not on the whole way, or they keep taking their hand and pulling it down and rubbing their eyes. All aspects need to be explained, like why is the cloth mask used? What does it do? What aspects need to be covered? Okay, staff need to be trained, instructed on how to use it correctly. We said the employer must make arrangements for washing, drying, and ironing of cloth masks. That is debatable. You can get your own people to wash their masks, but that is up to you. And although in the legislation it says that the employer must do it, and I stand to be corrected, adhere to what is being said, but I think that this depends how big your environment is, whether you have access to a washing machine on site. The important risk is made available. How to manage a visitor coming to your workplace. Make sure that there's a 1.5 meter distance between staff and member of the public. Ensure that physical barriers or shields are available. Ensure that appropriate visitor screening is done. Put up signs for visitors to understand your protocol and make sure that they wear masks. Do not feel weird saying you can't come in if you don't have a mask on. It's for your protection, their protection, and your clients. So basically, looking at some of the take-home points for this particular process is familiarize yourself with the relevant legislation relating to COVID-19 workplace. Appoint your COVID-19 representative. Conduct your staff risk assessment. Make sure that the persons feel comfortable and that there's confidentiality. Establish your procedures in terms of how you will arrange staff and return of your service users. And develop all your tools prior to the reopening. So what's important is that you have your work plan in place before you open. Interrogate the plan with your other colleagues. Look at what works for your organization. So you have time now before the reopening. Do your staff risk assessment. Look at the different job descriptions of your staff and who they interact with and how they interact. So you understand what particular risk level they might be at. Then take the space to look at what risks my particular staff have in terms of their own health and their own comorbidities. So then you're doing those particular things. So, and then develop what you would like to see as your pre-screening form. We decided to take the option of a testing station, which is a room that will be separate from any other contact room within the organization, so that we know who's entered and who's exited. Make sure that the documents are completed correctly. Don't sort of just have the screening form there and just, it's just a to-do then, and they just filled it in. You need someone that's going to actually look at that form, have a look and say, well, actually, I don't advise that you're here right now. You are presenting with potential symptoms. I suggest you go home and self-isolate. And then should further symptoms present, you need to contact your GP and possibly have a test. look at where your particular colleagues are that are interacting with that colleague that has at the office presented with symptoms, and they need to be self-isolated. Make sure the tracing information is correct. When you're looking at cleaning of your office, it's a lot more than the points that I've just put on there. There's a lot of procedures. You've got even to the point of cleaning the kettle, cleaning the stove, cleaning the utensils, who comes in and out the office. Putting up, what I've developed is a cleaning schedule per office. So your staff would have to come in and sign that they wipe their office down on arrival and that they wipe their office down on exits. Really strict needs to put in place that you cannot just freely move between offices because you don't know what the control measures are then. So for example, if you come back to work and suddenly you say, hang on, my station doesn't look right, my stapler's been moved, my punch has been moved, there's sweets in my box, so this has happened, there's been movement in my office and I know it wasn't me, then you need to call your staff in to say, listen, the reason why we're so strict with monitoring the movements, it's that you need to make sure that the risk of transmission is reduced. And that way, if you're going to move into your colleague's office, once you've left, make sure you wipe down everything. And then when that colleague comes back to the office the next day, the first thing they're going to do is to look at the surface areas and wipe down the phone and the computer so they feel comfortable. And then encourage the aspect around sanitizing and washing of hands. Infographics are so very important. Also, if you're dealing with clients that need sort of very easy to understand, there are lots of infographics that are easy to read. We are going to be posting some of that in our booklets, in our COVID-19 forms. Again, as I said, look at your risk assessment with confidentiality. And again, important to look at the aspect of stigma and fear and anxiety. There's a lot of that at the moment. A lot of your particular colleagues' children are returning to school, and the anxiety around that. What does that mean for me? What does that mean for me coming to work? How do I feel about working with someone that has had COVID-19 and now they're back at work? What are my fears around that? I need to understand what the transmission rate is going to be like between myself and my colleagues. Also, you can't wear your mask the whole day and then you go out for lunch and then you go hiding behind the corner with your colleagues and you take your mask down and you have a whole big conversation and you have your sandwich during your lunch break. All of those aspects need to be considered, that it's not just prevention in the office space, it's prevention during your lunch breaks, it's prevention when you're taking your taxi back home, it's prevention at your home. We don't know the different circumstances and communities and how people are behaving within their own home environment. Looking at my own particular example, my daughters are going back to school next week. I'm particularly anxious about it, but I know I've done all I can here in terms of prevention. I need to understand that others may not have taken those particular prevention precautions. However, I'm doing on my side whatever I can take to make sure that the school has done their prevention measures, and when my daughter comes home, my prevention measures are in place. Very much the same as when we are back in our office. A couple of us have been going in and out of office at the forum. We're doing all of the prevention measures that we need. And through that, we can reduce the transmission spread. And finally, again, just for your own, don't be caught up with, okay, now we're reopening, oh my gosh, I haven't got everything in place. There is time now. Develop your checklist, develop your plan, go through everything, make sure it's user-friendly for your particular organization. Familiarize yourself with the government Gazette documents and familiarize yourself with the relevant information and most recent verified COVID-19 information on your WHO website, on your communicable diseases South Africa websites. Try not to listen to too many Facebook posts and newspaper unverified articles on transmission and so on. Be knowledgeable. With knowledge comes power. With that power comes good decision making and ensuring that your staff feels comfortable returning back to the workplace. As I mentioned before, we have a lot of information available. Don't reinvent the wheel. If you want to access posters, they are available online, and we'll also be having them within our booklets, in our uploads. Make sure your PPE is available. Set up the training sessions prior. What you could do is even have for example, before maybe a lot of your clients come back. Obviously, we don't know the protocol yet, but it would make sense to have your staff back first so they can be completely trained, acknowledging their fears, letting them run through a couple of days of what it's like to work in this particular environment so they feel comfortable. Make sure you have your copies of your occupational health and safety measures and have information up for display purposes about hand washing, social distancing, and how to use PPE correctly and how to deal with the public. And if you have any information that you're needing from us, please feel free to speak to us and contact us. We are more than happy to answer any of your questions. If there are any questions, please feel free to pop them in on the chat. Amy, are you there? There's Amy popping up.
I'm here. There are some questions, Ruth, and I think I'm going to go through them, and I think also then I'm going to give people a bit of an update of what we're doing in July. So I'm going to tell you that we don't particularly have all the answers to your questions, and some of your questions require quite a bit more in-depth answers. So what we're doing for the month of July is trying to answer these questions and trying to look at answering questions around COVID from a medical perspective and then from a legal perspective. So I know some of you, and when I say legal, I mean specifically the legal aspect of employment and a labor law aspect. So what we're trying to get is get a labor lawyer who can talk to us about things like indemnity forms, consent from staff there is a question where Liz asked who has one comorbidity that is under control and she is on medication and she would like to return to work. Is that okay? I'm going to post that. Let's just chat this one through. If you've got a staff member who is at high risk, 58 years old, and she's just under 60, so you can't actually put a excluder based on her age, but she does have other conditions, which does mean that she's not going to work. But I think we need to unpack this a lot more with the labor lawyer so that we can actually ensure that we keep, as organizations, we keep ourselves safe, we make decisions. But labor law works is that we also need to make sure that we are making the correct decisions for the employee, and the employee is not being discriminated against as well. So if we don't answer those questions now, please, we are going to try and get those people together for July. We are going to try and get sessions together for you. They are a bit more in depth than that. There's another question, Ruth. We only have 3 staff in the same shift workers.
Sorry, you dropped line there. I'm trying to. Just went. I'm having a look at the questions on now. So which was that question?
So I'm reading a question from Tammy Kleinans who says we are only 3 staff in the center. Is it necessary to rotate or shift workers? Obviously, have a look at the legislation. If it is 3 workers, I don't think you have to do staggered working hours, but you would ensure that you have a social distance, basically. 1.5 to 2 meters, and that would be, and also put your protocols in place. Like, what are you going to do, for example, when the person goes to the bathroom? Like, what do you need to do to ensure that there is sanitization and it's safe for everyone else to use the bathroom? So 3 people is doable. You can function with that. You can space them out. They can be in different offices. You're not going to maybe have one-on-one meetings. You might do it via virtual or via telephone, or at least with a huge distance between. I know that how is pre-clean defined? We have actually got that in our COVID-19 return plan. And also in your occupational health and safety measures in workplace, it does detail what a pre-clean plan is. And also you need to go online and look at WHO also talks about what needs to be cleaned. So you can't get like overtly obsessed about it, because you can't clean the floors every 5 minutes. However, if you are in an environment where you have a high volume of people coming and going, your cleaning schedule is going to be a lot more than if you have 3 people in your office. Yeah.
You're going to
Can I also just add to your pre-clean definition question? A lot of what we're talking about in this session is going to be in terms of your compliance. And in terms of your compliance before you pre-open, you are going to need to provide proof that you've had your space cleaned correctly, that you've had your space disinfected correctly. So yes, you do need to hire somebody to do it, because you are going to want to keep that record. It is not about a manager of space going around with JIC. That is not the response that they are looking for. That's not the response that the guidelines are looking for. The guidelines are looking for a space of has someone come in and completely cleaned your space? The weekly clean, regular cleans, etc. Yes, that can be done by a staff member, but the pre-clean before people can come back to work needs to be done by an actual business that can give you proof that they cleaned the workspace. This is actually saying my speaker is not working. Okay.
It's fine now. It was just a bit iffy. Okay, you've now muted yourself. Unmute.
Thank you. I'm unmuted. That's weird. Let me just.
Okay, Amy seems to be muting and unmuting herself. I can see that there are a lot of very pertinent questions, and that's why we're definitely going the legal route to look at a labor consultant to come in. As we also mentioned, is that we have not got all the answers yet in terms of very relevant questions. How do we social distance with children with severe to profound intellectual disabilities? How do we get them to wear masks? All of that is still currently being worked on by the department, and we are waiting for information relating to that. I hear you regarding looking at if your particular driver has high blood pressure and so on. You need to sort of make the call around, is it under control? Are they on medication? How much of the risk is it? And if you have someone, you can't stop someone coming to work necessarily, because the Gazette doesn't give you a very clear, it says special measures, but it don't detail special measures. So I did find quite a nice example, which I think I'm going to actually put the link on, by a law firm talking around special measures and comorbidities. It is a bit of an open space. So again, I think definitely we are trying to locate someone that would definitely talk to the legal aspects.
Thank you, Ruth. I think I'm back on again. I'm very appreciative of everybody's questions. Thank you very much. We're going to try and go through them. I know that some of you need to leave. If you do need to leave, that's absolutely fine. The session will be available on our website as well. If possible, please give us until about Friday to have it uploaded onto our website so that you can listen to more of the questions. I'm just going to keep going through them. I'm going to say firstly that as far as we know, in terms of special care centres, there has not been an option, an agreement on you opening as yet. So we will keep you updated as soon as we have information about you being able to open. We will pass on that information, and I'm going to particularly look at training in terms of helping people with intellectual disability, children and adults, understand social distancing, understanding hand washing, better ways to teach them about this, better ways to improve their skills. We will be looking at a training session on that. I understand it's very difficult to do that. I'm trying to go through the questions. And you will see that if you are here, you will see that Busi has put up the link for the evaluation form. And it takes about 4 minutes to complete our evaluation form, possibly less if you've done it a couple of times. So very simple, very straightforward. You just click on the link and you answer the questions that come from that. We will send everyone an attendance certificate, but I do want to add that as part of your compliance, you will need to prove that you've trained your staff on COVID-19 and on workshops like this. And how we can help you with that is if you email me, if you have a session at the moment and you've got 4 or 5 of your staff members, or as somebody has put in the chat, they've got all their team watching the session, please email a list of your staff members to me. Names, surnames, please correct names and surnames. Please, this is sending you certificate is quite a tedious process, so please make sure we get the correct information. Correct names and surnames of everybody that was sitting in the session. Email it to me. I'll put my email address in the chat section as well, and then we can send you attendance certificates and you can use that as proof of training. If you've got more staff that you need to train, then email us and contact us and we can provide this training to your staff in your own space. We can do a Zoom session to just your staff and we can answer all their questions. We can add hand washing, we can add social distancing. And we should also mention that social distancing should be carried out throughout the session, throughout your working day. It should not only be when you're working with the children, it should be when your staff are on tea time. It should be when your staff are arriving at school. It should be when your staff are helping learners get onto the bus or helping your residents, just changing, etc. Social distancing should be in place at all times. It's not only when staff are actually in the process of working. I'm just trying to get through. Ruth, do you want to add anything?
No,
the protocol regarding transporting children. We have put something around that up, but I will try and find it again. I think we have done a session on that, or we have included in the training, but we will try and find some more information on that. Please watch our Facebook pages for it. That has been updated. Are employees expected to provide proof of a retest if they tested positive? I can tell you the answer is yes. Employees actually only allowed to come back to work once they've tested negative, and they need to bring you proof that they've tested negative. I do remember that Ashley posted that someone can test positive for 6 weeks after that as well. One of the training sessions we're looking at in July is having a medical doctor on a training session to teach us about COVID and to also help us with all of these questions regarding returning to work and testing. Just pick a question.
Okay, sorry. No, I'm listening. You're going on quite nice today. I did see quite a lot of people that were asking for training from our side, to train carers, to train staff, and so on. And we'll be very keen to be able to provide that support. So these questions that you are raising here are fantastic. And that really guides us and to develop the training that you're needing specifically before you reopen. I can see that, so a lot of people, DOH is, Tammy Clayton says that you got an email from DOH requesting a survey to be completed. It's a survey regarding IPC training. It's a session regarded as IPC training. Amy, do you know anything about this?
What is IPC? Where is Tammy?
And so, Tammy, can you tell us what IPC training is? Tammy, we're waiting if you are still on, because that was interesting. Apparently, Department of Health is sending something out. Yes, we can definitely look at training for carers and facilitators. I can forward
IPC,
you
IPC is infection prevention and control.
Thank you.
Thank you.
We can definitely look at a training session on that as well. But yes, we will do a training session for your staff. It is very, very possible. Please contact us and we can make an arrangement for that. So thank you very much, Lee, for your thank you. We do appreciate the comments, the compliments as well. It is really a matter of us. We're trying to learn as fast as possible, really. So I can tell you we don't have all the answers, but we are trying to learn and are trying to give you information as fast as possible. Yes, you can arrange regular training of your staff to make their time more productive. Absolutely. If you've got staff that have come back, but you don't have children that have come back yet, and if you are staggering your staff, then yes, you can definitely add training into their spaces. Our previous webinars are available on our website, and if you want to use that and then receive attendance certificates for your staff that you have, records that they have been trained, then contact us and we can have a conversation about what the options are for that. But we are very open to giving you options for that. Earlier, I shared the coronavirus, the SA coronavirus website, and it's actually a very helpful website. They've got all the guidelines, videos, infographics, activities for children, how to share information about COVID with children. I actually spent a little bit of time on the website, and once you spend some time on it, you actually see that they are giving us quite a bit of information. I just wanted to touch again on the package that we are putting together for you and for our members. So what we're going to be doing is looking at templates, and some of you who work at special care centers will know that we've done this with policies before. We've given you a list of policies. So what we're doing is we're writing up the templates for an assessment form, for your COVID policy, for your risk assessment, even for your jotting down of temperatures. We'll give you templates for all of that. All you'll need to do is add your letterhead, and you'll need to adapt it for your organization. So you'll need to actually really read through it. It is not as simple as printing and putting in a file, please. It's not as simple as that. You're going to have to read through it. You're going to have to understand what they're giving you. And for those of you who do not have easy access to the internet to download all these documents, we'll put it on a disk for you. The disk will be available at the Forum offices, and this will be free of charge. It is a service that we are offering. All we're asking in exchange for it is that you provide us with, if you want to download it, there'll be a registration form in order to download it. And if you collect it at our offices, there'll be a sign-in sheet for that as well. Training for staff specifically regarding do's and don'ts is very helpful. Yes, I agree. Because you have been open throughout, it must be very difficult to train staff when you have been open throughout lockdown, because now you have to introduce new processes, new policy when actually they haven't even left work in order to understand the process of lockdown. So I do think we are going to have to look at a session specifically for those of you who have not closed and now need to introduce new policies, new procedures, etc. And I think also I will find out about the cleaning for places that have not closed, because that is going to be a bit of a challenge.
Can I also add?
Yeah.
Oh, sorry. Just in terms of the concern around the cost of testing, I'm going to also do some work around that. A couple of companies and so on are now offering free testing. I know the Dis-Chem group, quite a few of them have now been offered like financial support for testing. So, but we'll find that information out and also then be able to provide it, because we need to ascertain where does the cost lie. Does the cost lie on the individual? Does the cost lie on the employer regarding the return to work cost of testing? And I think that's something that having the legal person would be great. Just to, I'm sure those are lots of questions that have been asked at the moment.
Absolutely. So thank you for that, Ruth. Yeah, so what we do, guys, with your chat is that we save all of your questions. We've got your basic understanding, we go through it, and what can we provide as soon as possible? What training can we provide? Who can we source? All of those things. If you want to have any information about anything related to COVID, again, contact us and we'll try and get you on as a presenter. We're always looking for presenters. I think what I also want to add before we just a bit of closing up after this session, all your certificates, in addition to the whole of June, all your certificates will be sent to you on Friday or by Friday, including those of you who applied for CPD points. We did get 2 points for those sessions, 1 each, so you'll get 2 CPD points. Those will be sent to you by Friday. And then with that will be our program for July, which I said does include some interesting topics. So next week we're starting with a bit of self-care, a bit of lightness, a bit of caring for yourself. There's a lot of anxiety and a lot of stress at the moment, rightly so. It is absolutely normal for people to feel stressed, anxious, in a space of a very high anxiety environment. There's a lot of things going on. So we're looking at next week just doing a session on some self-care, a little bit light-hearted, a session on organization. Because we are now recording this, we have to be online. My speaker's not working again.
Okay, now it's fine.
Is it? Okay. We are going to be doing a session on digital transformation, and then we're also going to be doing a session on about what comorbidities are and how are they, why are they important when we work with clients with disability. And then we're also looking at labor lawyer and how we can answer all of your questions around this space. So again, Pussy, can I ask you to post in just the evaluation form again first, and we will thank you very much to those of you who complete them. It's really helpful, and you will see that in July's training session we have used your information to plan that. So we will look at the cleaning processes for residences, for group homes, for special care residences, and for CYCC. So if you want to, we will look at the cleaning procedures for you and we'll get a technician on that. I think that is all. Ruth?
Yep, I think we've got a lot of work on our side to do. I'm very happy around all the questions. It really helps and guides us. So we're going to get onto that right now. Thank you everyone for joining us. And as Amy said, we're going to have that document ready for everyone by next week.
Yeah, and just for those of you who are interested in today's presentation, I have just posted it in, that went to somebody privately. That wasn't the point. I am putting the presentation in the chat group at the moment. You are welcome to download it from there. And just to get all of that information. And then once again, once we have our downloadable package available for you, I think we will send it to everyone and to all our membership as well. And then for those of you who need it in a disc, we will let you know when it's available at the office. Please be aware that because of social distancing and because of the protocols, we will give you a time frame for collection. We will not be open at all times for collection. We will give you a specific time to collect that disc, just to ensure that our staff and your staff stay safe. So thank you, everyone. Thank you for joining us today. Thank you for the interactive session. It was really, really lovely. We hope we've answered quite a few of your questions. And those that we haven't, we will get on to getting the answers to that as well. Thank you. Thank you. Have a lovely day further. Bye-bye.